Hi, Bianca here. I am at Horizon Radiology. I'm just in the car at the moment. I've come to get my dating scan for my pregnancy, and I've come a little bit early just to make sure that the appointment's all correct. I haven't received a confirmation call as yet, which I think is a little bit strange, but I was busy this morning so I couldn't ring them. My appointment is 11:40 a.m. and I was told to empty my bladder at 10:05 a.m. and then I had to drink 750 mils of water, which is the same size as a Powerade or a pump bottle. I've got my little form my midwife Jill Dale gave me to fill out, and I'm just going to go into reception and have a chat to the ladies and confirm my appointment. I have to be honest, I've been quite anxious about this appointment simply because I have miscarried before, and this is the scan where you actually find out whether you have a heartbeat. So it's not that I'm worrying, it's just that I am just doing all the right things and not getting my hopes up too high in case I do get disappointed. So there is that little bit of concern there, but not necessarily stressing about it. I guess, you know, when you've been through these things before, you've just got to be prepared. So I'm going to go inside. I think my fiance Daryl maybe or may not be meeting me if he can get off work, and let's go see what's going to happen. I've just had my dating scan and my midwife is correct. We are going to be due on the 20th of November, which my fiance isn't too pleased about because his birthday is the 19th of November. So those are the sacrifices that you have to make. As I said, I was really anxious going into this dating scan simply because I have miscarried before. I was all right a couple of weeks ago, but the closer I got to my appointment date, the more concerned I got about the reality of it. So for me, having a dating scan has really just confirmed that yes, there is a heartbeat. There is only one fetus, so we are having one child, as triplets and twins run in my family and twins run in my partner's family. So one baby to take care of, a little bit easier on me as it's my first child. And they were really lovely. We got there at 11:40. We didn't get in till about 10 past 12. So if your partner is coming and taking time off work, just, you know, maybe 20 minutes later, because we always know that these places run a little bit later. And they got me to lie down on the table. I wore a dress and didn't consider that possibly I should have worn pants and a top, but that's okay. They just put a blanket over the top of me and put some gel on my tummy, and then put I don't even know what it is, an ultrasound scanner on my tummy, and that was quite warm, and just went over the top of it. Here is my thermo picture, and that is our baby. And I guess the thing that was cool about it, it's 12 millimeters at the moment. It's not huge, but for me it's huge, and it has a heartbeat, and you know, that's all I really care about at the moment. So it's just a matter of getting through the next couple of weeks so that I can make it to my 3 months, and then I will feel super confident that everything will run smoothly. I think that it will anyway. I'm just being a little bit cautious because we really want this baby and we want it to be healthy, and I'm going to do everything that I can to ensure that that happens, even if it means locking myself up in the house for the next couple of weeks. So the other thing that I didn't talk about in my last video when you miscarry is if you are Polynesian or you do want the afterbirth, you do have to let the hospital know before the operation that you want the afterbirth. If you ask them afterwards, it would have been disposed of. So part of Daryl and I, our moving forward, we had our baby and it went for tests just to make sure that there was nothing wrong with it. And then we actually brought a bougainvillea. Most people do roses. I wanted a bougainvillea for some reason, and we had a ceremony. When we had that ceremony, and it was weeks afterwards, I did actually break down, and that was a little bit of a surprise. But it's therapeutic. I think that it's important. Daryl talks to the plant a lot. And the strange thing is, it wasn't doing too well, and then about a week before we knew we were pregnant, it just started blooming. So go figure. But at the moment, it's happy times. I don't have to be so anxious as I have been over the last couple of days, and I'm going to get Daryl to have a chat to you guys and let you know from a male's perspective what he's feeling and thinking and been through, just to get us to this point of being pregnant and happy. All right, we'll chat soon. Bye.